What is the inheritance pattern of ATP13A2 mutations? Have you ever wondered how certain genetic mutations can lead to specific diseases? One such mutation is found in the ATP13A2 gene, which is closely linked to a rare form of Parkinson's disease known as Kufor-Rakeb syndrome. This condition is characterized by early-onset Parkinsonism, often appearing during childhood or adolescence, along with other neurological symptoms. The inheritance pattern of ATP13A2 mutations is typically autosomal recessive. So what does that mean? For someone to develop this disease, they need to inherit two mutated copies of the ATP13A2 gene, one from each parent. If a person inherits only one mutated copy, they are considered a carrier. These carriers usually do not show any symptoms of the disease. However, some studies suggest that having a single mutated copy might lead to milder or later onset forms of Parkinsonism in rare cases. In autosomal recessive inheritance, both parents are typically carriers of one mutated copy of the gene, but they do not have the disease themselves. When two carrier parents have children, there is a 25% chance that each child will inherit two mutated copies and develop the disease. There is also a 50% chance that the child will be a carrier and a 25% chance that the child will inherit two normal copies of the gene. While most cases of Parkinson's disease occur sporadically, ATP13A2-related Parkinsonism stands out due to its clear genetic inheritance pattern. The disease mechanism involves a loss of function of the ATP13A2 protein, which plays a crucial role in lysosomal function. This dysfunction can lead to the accumulation of abnormal proteins in brain cells, particularly alpha-synuclein, which forms Lewy bodies, hallmarks of Parkinson's disease pathology. It is essential to remember that not all cases of Parkinson's disease are inherited. The inheritance pattern can vary based on the specific gene involved. For instance, mutations in other genes, such as LRRK2 or SNCA, follow an autosomal dominant pattern, meaning only one mutated copy is needed to increase the risk of developing the disease. In summary, the inheritance pattern of ATP13A2 mutations is autosomal recessive. Both copies of the gene must be mutated for the disease to manifest, while carriers of a single mutation are typically unaffected. Ongoing research is examining whether single mutations might have subtle effects. For individuals with a family history of early onset or juvenile Parkinsonism, genetic counseling and testing may be beneficial to understand risks and inheritance patterns better. Always consult a healthcare professional for personalized medical advice.